I was working as a care assistant at a care home in Staffordshire. And so I applied when I think I must have been 17 to become a mental health nurse student. I applied to St George's in Staffordshire and I was lucky enough that I got in first time. And so I started to become a student nurse in July 1987.
So I think I've always wanted to be a nurse. Literally when I was a teenager and visited my granddad in hospital and was fascinated by seeing all these people moving around. They clearly were all interlinked, but it was like they were all doing different things, and I was fascinated by the choreography of it. And my very first role when I qualified was on a daybed unit.
So I guess the die was cast for me in terms of my future career in the NHS. Both my mother and father had senior roles in the NHS and had joined in 1947 as the NHS was formed. So my first role was actually that as a cadet nurse.
My journey to the NHS, I think, is probably very similar to most medics in that I went to medical school because that's the only way into that career. And I joined as a house officer.
I applied to do my nurse training and originally was going to Wales, and then I got cold feet about whether I actually wanted to do that as a career. So I applied for a post as an auxiliary nurse in the local theatres at my local hospital. The nursing officer suggested, why are you going to Wales? Also suggested I might not get an insight into true nursing as all the patients would be unconscious.
I think the NHS had been around, nearly 40 years when I started training. So, we're talking about that's 36 years ago, as I said. So people still loved the NHS. I think the public, they were very much recipients of care. It wasn't that you could Google my symptoms on the internet and you tell nurse what's wrong with you. It was very different back then. People were really looking to you as the nurse and to the doctor to tell them, this is what's wrong with you, this is what will make you better.
From my perspective, the NHS was always seen pretty much as a treasured institution, the start of my career. It has always been a very challenging environment, a very rewarding environment to work within.
Those people who are around my age will remember the series called Angels. And it was these very lovely nurses doing their stuff, and we were seen as angels. My father-in-law, who died a good number of years ago, he had heart trouble and he was in hospital a lot, and I think he was always very reverent to me because I was a nurse, and we were always busy. It was very different. You didn't have the challenges of the finance. We never knew what was happening with the money, but I went into nursing expecting to be busy, and we were always busy.
The NHS has supported me actually throughout the whole 50-year career. I'm a great believer in setting personal annual goals and a great believer in continued lifelong learning. And the NHS has facilitated that for me in spades. It's given me opportunities that at the start of my career I'd never dreamed I would have the opportunity of engaging in.
I think we need to recognise the NHS actually provide us a whole system, a whole ready built ecosystem to work into. We had jobs to go into, we had a clearly defined support around us, we had a whole range of services around us. It was, we were surrounded, enveloped by the NHS. We were part of an NHS team, so you're very much, you belong, not having to do things in isolation.
I've always felt supported by the NHS. I know it's a really corny answer. I've always been supported. We're sheltered, aren't we, from those largely, but will we still have a job tomorrow? Where's the money come from? Especially if you're a nurse.
Yes, so like I said, I was quite young and possibly naive, and we worked on the wards, and I remember at one stage sitting on the floor talking to a patient thinking, I'll keep myself below the patient, don't want to patronise. And the sister walked in and goes, nurse, will you get off that floor? Sit on a chair. And I was like really taken aback because how strict she was. And certainly when I did my general placement, I remember I liked to talk to the patients to see how they were, and I recall being told, you're not here to visit, you're here to nurse. And to me that was quite challenging back then because I just thought it was all important that you actually got to know your patients. So there were some real dinosaurs as I remember and as I look at it now, and I just thought, I really don't get this. But yeah, really strict and felt a bit archaic and a bit old in what they did, but that was how it was back then.
So my job in a community hospital, as I say, effectively looking after 7 wards, and all that comes with that. And it was rehabilitation and older people. And we had a lot of deaths. I mean, death happened a lot. And I think that was challenging. You very quickly develop communication styles that are adaptable. So, for example, there was many a time I'd be caring for someone and they'd pass away. And the relatives would come along, I'd be ringing them, saying, yeah, your loved one's gone. Do you want to come to the hospital? I'd never met these relatives before in my life or in their life. And you're seeing them at their rawest. And I suppose that's the time when I was very mindful of how I behaved, what I was doing. And I did find that really, not hard, but I think it's one of the most challenging things I ever did, bizarrely, because you are meeting these people at their rawest. Whatever you do at that point, they're going to take with them for the rest of their lives. And it's hard, but it does help you to develop communication styles effectively that you'll use for the rest of your life.
Yeah, there were a number, and you'd expect there'd be some challenging moments, particularly when you think about some of the very poorly patients you had.
I think the highlights of my career are actually coping and managing to be a nurse, to have a family, to be a mother, to be a wife, because that's pretty hard. It's hard to do.
So joining as a student nurse as someone who's rather naive, you know, this country girl that's come to the town and starting to learn nursing, it was quite daunting to begin with, but you get joined with a team, and there was 4 of us that were all together doing our training together. And I think it was just so important that we were given the chance to work on the wards pretty early on. And I got to work with people who were at the most vulnerable. And I've always said this about mental health nursing. You work with people at some of the most vulnerable times of their life. And I just remember that being so important to me back then.
I think the fact that I'd become a doctor at all, I think I was very excited about, and the responsibility and the ability also to work within a team. And there's a terrific amount of learning. You just learn every day. You learn something pretty much new, and it was very exciting.
The opportunities to do training and move on to where I am now and that career pathway, always been supported through that challenge, and had a lot of experience both with not just children, elderly care, infectious disease.
The other thing which was immensely rewarding and a real privilege was working at that time with many patients who were veterans from the Second World War, and actually working in quite large institutions at that time and trying to meet the needs of that group was a real joy. So I'm very grateful to the NHS, and hopefully I've offered a commitment that's made a difference to the patients and the communities that we serve.